Thank you, and welcome to Near Village Market in Nairobi. We are quite glad to be here at HealthX, and today we want to talk about what you are seeing in front of us here. But largely, I think we have a gentleman here who can explain to us a bit about HealthX. Please tell us about yourself and HealthX, the company.
Absolutely. Thank you for having me. So my name is Qaizer Manji. I'm the CEO of HealthX Africa. My background is in consulting. So prior to this, I spent a very long time as a management consultant, where I served companies across East Africa, the UK, South Africa, on topics such as corporate strategy, digital strategy, transformations. I then spent a bit of time towards the end on healthcare and healthcare in Kenya, which is where HealthX was eventually born from. In terms of HealthX, so HealthX is a virtual healthcare provider. We like to think of ourselves as the first of our kind in Kenya. Our vision is to have a doctor for every Kenyan. And our mission is to leverage technology in order to provide high quality and affordable primary health care across Kenya. The way we do that is we leverage technology. We have a set or a team of in-house doctors, as well as a wellness advisor and a clinical psychologist. They are all fully employed by HealthX. They work out of our offices, so they're just behind us. And they are here to serve our patients. So our patients or our customers have unlimited and immediate access to any of our medical team members. You can call our toll-free number and it will connect you to one of our doctors within 20 seconds. Or you can use our mobile app to do a video call or a live chat with one of our doctors.
So when you look at the space, because people have talked a lot about digital health.
Yes.
What is the bigger picture for you? Why go digital?
Yeah, absolutely. I think the answer is quite simple. I think technology allows or enables people access. Today we don't have enough money to build hospitals and clinics in each and every county, in each and every city, in each and every village. And so technology bridges that gap, right? So the way we operate, as I said, we have a team of in-house doctors. We are leveraging technology to connect the patients to our highly qualified doctors, right? So my doctors are based in Nairobi. You can be a patient in Lamu, for example, and leveraging our technology, you can connect to our doctors who are based in Nairobi. And I think, so as I said, I think technology just enables access, and it allows you to actually scale healthcare across the country.
So I'm seeing this equipment here.
Yes.
What does it do?
Yeah.
And how does it operate? And how does it connect with the doctors and the patients?
Absolutely. So this is what we call a virtual clinic. In terms of its uses, we've implemented it at corporate offices. It can be used in schools and universities. It could be implemented in kind of underserved remote areas. But essentially this is, a small clinic. So you would come, you would sit here. If you're already a member of HealthX, you log in using your ID number and your unique identifier. Once you log in, it pulls up your medical record, and if you hit call a doctor now, it will connect you to one of the doctors. The devices that you see on the side are actually smart devices. So if, for example, the doctor says, we'd like you to check your temperature, then you would be able to check your temperature, and in real time that data would feed to the doctor and actually pop up on the screen. And so it's a much lower cost version of an actual clinic.
Oh, yeah. Now, I think one thing you talked about is the history of your company. How old, how young is HealthX?
Yeah.
And what are some of the major milestones that you've really seen you've hit so far?
So, good question. So HealthX is just over a year old. We have been operational for just over 5 months now. In terms of major milestones, we currently employ 23 people. Out of the 23, 13 of those people are healthcare staff, so doctors, wellness advisors, clinical psychologists, and care coordinators. We are currently at just over 3,000 active subscribers, growing quite rapidly, and we're projected to exceed 30,000 within the next 3 to 4 months.
Okay.
Yeah.
Now, talking about those milestones, I think for a young company that is really just a year old, that has been fairly fast. But then, what separates HealthX from the rest? Because one thing I notice is you have internal staff
Correct.
who actually deal directly with clients out
Yeah.
there. But there are also quite a number of others that don't have staff, but they kind of pull doctors.
Exactly.
What separates your company in those two aspects?
Yeah, good question. So, as you said, typically the telemedicine model is the Uber type model. It's a platform. You as a doctor could be sitting at Nairobi Hospital, Kenyatta Hospital, Aga Khan Hospital. You come onto the platform. As a patient, you want to speak to a doctor, you would come onto the platform, and the platform will connect the two of you. Just the way Uber works. The issues with that is twofold, right? So one is that you cannot control the service delivery, right? So as a doctor operating in Nairobi Hospital, I practice a certain way, I deliver my service a certain way. As a doctor operating in MP Shah, I practice a certain way, I deliver a certain way, and therefore you can't control the service delivery. So that's issue number one. The second issue is that there's no continuity of care. So what I mean by that is, as I said, you'll call Dr. A, you'll explain your medical history, they will ask you a bunch of questions, and they will make recommendations. 2-3 days later, you want to follow up, you'll be connected to Dr. B, and you will have to repeat all that again. So how we're doing things differently is, as I said, we have our own doctors, and each of our patients has their own electronic medical records. Why is this important? So number one is on our own doctors. They are trained by us. Obviously, they all have their own experience, but they are trained by us. They operate based on our guidelines, and so we can control the service delivery. The second thing is that each of our patients, as I said, has their own medical record. So if a patient calls in today and they connect to Dr. Isabel, for example, she will ask them questions. Everything will be noted on the medical record. And when they call, if they call back the next day, for example, and Dr. Isabel isn't on shift and they get Dr. Martin, he will be able to see the medical history. He will see what Dr. Isabel recommended, and therefore he will be able to make his recommendations accordingly. And so the idea is we've changed that model in order to better serve customers and patients.
Are there partners you've worked with, or external organizations that you work with to deliver on your mandate?
Absolutely. So yes, we're a healthcare provider. We strive to provide a service across the continuum of care. And so we have partnered with pharmacies, for example, Good Life and MyDawa. We've partnered with lab companies, for example, Pathcare, Lancet, Ilara Health. We've also partnered with financial service providers such as Power, as well as emergency ambulance services such as Rescue. The idea is, we can put all the pharmacies, for example, in Kenya and say they're all our partners. But the reason we have just a few and we've handpicked them is one of our core pillars is quality. And so we make sure that we vet each and every one of our partners for quality, so that if a patient comes to HealthX or they're a member of HealthX, and we send them or we get their medication from Good Life, for example, we know that they are delivering high quality medication, and so the patient is still receiving the best of the best.
Being a year old, I think this has come in when there have been quite a bit of changes, including probably in the regulatory landscape.
Yeah.
How tough was it to get through? How easy has it been? Are there changes that have worked in your favor to be able to deliver on this kind of technology and customer service?
Yeah, so I think COVID definitely helped, because prior to COVID, there was nothing like a virtual medical service. Having said that, we are licensed as a level 2 clinic, because we do have an in-house clinic where patients can come and see our doctors if it's deemed necessary by the doctors. But I do think COVID helped that. Because that allowed us to get a virtual medical license, which then allowed us to deliver on what we set out to deliver.
Yes. Are there any setbacks? Are there any tough places that you've had to go through to get this going?
Good question. I think, the biggest thing for me is the belief that, you cannot be treated over the phone or via video call. That was one, and it's kind of related to the fact that, people feel that, the doctor needs to check their blood pressure, check their vitals. And the second is people not knowing who's on the other end of the phone. So if you call the toll-free number, you're not doing a video call, you can't see who's on the other end of the phone. So I think to tackle that, number one is that, globally it's suggested that 70% of non-life-threatening conditions can be solved by speaking to a doctor over the phone. Secondly, if you ask any one of my doctors, 80% of their diagnosis is actually based on the questions that they ask you. And not on the vitals. The vitals are actually a nice to have. And then on the second piece around not knowing, one of the things we've tried to do is make sure the doctors are at the forefront of everything we do. And this gives the customer comfort that, if I speak to Dr. Yvonne, for example, who's one of our doctors, they may have seen her somewhere, they may have seen a billboard of her, they may have heard her speak on different webinars, and therefore they know that she is a real person. And so I do believe there is a bit of kind of mindset change that will need to happen over time, but I think we're slowly getting there, and you will see more shift into the kind of digital health versus traditional.
So here we are in Nairobi, but then of course with digital you can reach a bit more. What would you say your market is so far from your subscribers? Good
question. So the majority of our subscribers are based in Nairobi. However, we do have, close to 10% of our subscribers based in Mombasa. We have done consultations with people in Lamu, in Baringo, for example. So we are Nairobi centric, but we are actively trying to expand across Kenya quite quickly, because I truly believe it's that person that's sitting in Turkana that needs our services more than anything.
Now, there's something you've talked about, really, this being a digital technology company. In delivery of healthcare, what's the bigger picture about technology? And especially now with COVID and things are changing to adopt into this kind of stuff.
Yeah. Look, as I said, I think the biggest thing is access. We don't have enough capital to build, brick and mortar facilities. And, there are so many things that you can solve by speaking to a doctor over the phone. This is not to say that we're trying to kind of compete with hospitals. I think it's relieving pressure from hospitals, for example, because the person who just has a flu doesn't necessarily need to go to the hospital. They can speak to a doctor. Yes. Hospitals should be kind of for emergencies and for operations, right? And so I think technology will enable access, will allow people, like I said, the person sitting in Turkana, to be able to access a doctor that's in Nairobi, right? Today, people across Kenya probably want the best care. However, doctors are probably not willing to even move to these remote locations.
Yes.
So the technology provides that access. So someone in, for example, Baringo, as I said, can connect to one of my doctors in Nairobi.
Now, of course, you have really the first 1 year kind of crystallized and you have a growing business.
Yeah.
If you look at it in the next 5 years, because that's really going to be key for you.
Correct.
What would you want to spend most of your money and time on?
Yeah.
Could it be growing your markets, getting more people in, facilities? Where would you put most of your time and money?
Yeah, so I think 3 things. One is we would like to grow kind of regionally, so within East Africa. Second thing is I would love to grow the footprint of the VCs. Yes. So, 5 years from now, I'd imagine having 1,000 virtual clinics across Kenya, right? And the third thing is, increasing the number of doctors that we employ, the number of healthcare staff that we employ, to ensure that we can manage, the demand that we will see.
So that's one. So you want to grow your geographically.
Correct.
Grow your numbers of people.
Yes.
and impact. Now, let me ask you, for this virtual doctor service, this equipment here,
Yep.
if somebody wants it to have it in their school, in their whatever, what is the process?
Yeah, so absolutely. So we work with a lot of corporates and schools, universities. They come to us, they can subscribe their members. Our retail subscriptions are as low as $4.95 a month, or if you pay for the year in advance, it's less than 290 shillings a month. That gives you unlimited access. And then we charge a small fee extra for implementing the virtual clinic at your premises.
Is there, so will the equipment come in free? You just subscribe your members?
Once you subscribe, as I said, then we'll charge a small additional fee
Okay.
to set up and implement the virtual clinic at your premises, including the smart devices. And then once the employees or students are members, then they can immediately access one of the doctors through this platform.
How tough is it to deliver on it?
So a good question. I think the biggest challenge is around getting the devices. That has been proven to be the toughest challenge.
Yes.
We've seen a lot of demand from corporates, schools as well, who want this at their premises. It works really well when, for example, a corporate has an on-site clinic and you have a nurse. This is a great thing to supplement because the nurse can only handle up to a certain level.
Okay.
And then when they need to be referred to a doctor, now that employee or student doesn't have to travel 5 kilometers to see a doctor.
Yes.
They just go into the next room, they hit a button and they connect straight to the doctor. So we've seen a lot of demand, but I think the biggest challenge has been getting the devices. However, I think we've crossed that hurdle and are now kind of ready to roll it out.
Okay. Of course, now as you talk about rolling out and growing, there will be need for money.
Correct.
Maybe more partners. How are you planning to grow financial side?
Yeah. So currently HealthX is funded privately.
Yes.
As we grow, we will look to external strategic investors to help us achieve our vision and our mission.
Now, of course, the bigger picture is that people talk of healthcare being one of the biggest growth sectors.
Correct.
And of course, with COVID, that has been amplified. Where do you see HealthX in the next 5 years?
Yeah, so I'll take you back to the start where I said, our vision is to have a doctor for every Kenyan.
Yes.
And in the next 5 years, my personal ambition is to ensure that we're, at least 75% of the way there. By that I mean, we are delivering against our mission of leveraging technology to provide high quality primary healthcare, and we are serving, at least 75% of the population of Kenya.
Okay. As we finish, is maybe to give you an opportunity just to make a final comment, maybe reiterate on something that we haven't covered.
Yeah, I think, from my side, as I said, we have a mission to kind of leverage technology to deliver on high quality, affordable and accessible primary healthcare. We have started, we still have a long way to go. And I do hope people see the benefit in what we are doing, and I hope there is some sort of uptake.
Yes, and I think Qaizer, with that, thank you for the interview.
Thank you very much.
We're quite glad to be here and to see the equipment and meet your team, and we look forward to another interview in the next 2-3 years.
Thank you very much.